Well, back to school is right around the corner, so we want to get moving this Monday morning with a checklist beyond new school supplies.
That's right. We've brought in a family medicine doctor and a dentist live in studio with some tips to keep kids healthy. Dr. Randy Warren is a family medicine doctor from the Health Partners Coon Rapids Clinic, and Dr. Angie, dentist from the Health Partners Dental Clinic in Plymouth. Thank you both so much for coming in.
Thank you
Thanks
for inviting us.
Randy, let's start with you and talk about immunizations. I think that's the number. Certainly parents this time of year, you worry about ticking off those things that you need to have done before you go back to school, right?
Absolutely. School time of year is a very busy time of year for parents, and parents of have a lot to do, a lot to keep track of, and having immunizations, number one on the checklist, is very
Age milestones for people to be aware of before kindergarten, right?
Before kindergarten, there are some immunizations that are required in Minnesota law for entry into school, but also for good health.
And we kind of have those on the screen here. Kids 4 to 6, these are the required immunizations, right?
Right, and also before 7th grade, there are another set of immunizations required for entry into school.
And that's, we look at the meningococcal vaccine and HPV, also
correct.
something you want to have a discussion with your
And a
tetanus booster, all right?
I think parents with kids in school are getting their kids a physical before, but ready to do before school starts.
Absolutely. We want to make sure that kids are up to date on their checkups, and that physical examination. It should also include screening for vision and hearing, and an assessment of the child's developmental and social and emotional health as well.
Angie, let's talk about the dental side of this. There's no doubt, I think, over the parents and kids both get lax a little bit with, things like bedtime, but also with dental care probably too. This is a time of year to make sure you get back in and see that dentist.
Yeah, definitely. Back to school, as long as you're getting appointments done, it's a good dental checkup also, and just to kind of get back into the routine of the night again. Another thing that some parents don't think of that's important, also kind of going along with those athletic physicals, is to make sure if your child is participating in sports that they have a well-fitting athletic mouth guard.
Oh, yeah. Danger to your teeth. I mean, we think about it in hockey, right? The stereotype of a hockey player with if you're not a legit hockey player unless you have a couple of teeth knocked out, right? But it's other sports too, the same risk. Yeah. Soccer, gymnastics, you name it. Like
Yep,
you have that risk. Yeah.
What we would do when I was a kid playing football is we would just go buy the cheap $2 ones, stick it in a bite. That's not good.
No, they're okay.
Yeah, it's better than nothing, right?
But there are, some children will have trouble competing with that because if they're a little bit bulky, they can kind of obstruct breathing and that sort of thing. So the custom fit ones, older will last you a few years, and they're kind of easier to deal with.
So this is kind of the overview of the health checklist. We mentioned immunizations, physicals for sports, dental health, but in the middle we also have tests. Doctor, that's another good thing for people to think about this time of year?
Absolutely. We want kids starting school are in the best position to be ready to learn how to read and do math and see the front of the room.
Vision's a big one. I mean, my youngest son, he would say to us that he couldn't see the time on the microwave in our kitchen. And we thought, is he just being dramatic or is it true? And sure enough, you go and get it checked out. And
absolutely.
Good reminder for people to do that.
And during adolescence is when a lot of change in vision can occur.
Good. And your dentist or your family doctor both can identify some of those other things too. So get on in there and see them. Thanks, guys, for coming in. We appreciate it.
Thank you.
Thank you.